Antitussive drugs play a crucial role in managing cough, and among them, codeine stands out. This opioid acts directly on the central nervous system to elevate the cough center, effectively reducing the tussle impulse. However, it comes with side effects like insomnia and respiratory depression. Ethylmorphine, closely related to codeine, offers similar benefits but is believed to be less constipating, making it a viable alternative with a typical dose of 10 to 30 mg TDS. Pholcodine, on the other hand, is unique as it lacks analgesic or addictive properties, with a recommended dose of 10 to 15 mg. Noscapine, derived from opium, depresses cough without inducing dependence, available in tablet and syrup forms, with a dose of 15 to 30 mg. Dextromethorphan, a synthetic option, acts as a central NMDA receptor antagonist, providing antitussive effects without suppressing mucociliary function, though it may cause dizziness or nausea. Lastly, Prenoxdiazine works by desensitizing pulmonary stretch receptors, with a dose range of 100 to 200 mg. Each of these medications offers distinct advantages in cough management, allowing healthcare professionals to tailor treatments to individual patient needs.